So what exactly is the clicking or the cracking sound during a correction, meaning a chiropractic adjustment? Well, I'll tell you first what it is not is bubbles popping. Look at the article quoted below. It goes over all the resonances and sounds. The truth of the matter is the sound is a vibration. Just like a finely tuned musical instrument, you are beautifully and wonderfully made. Loud cracking sounds are high-intensity vibrations when a bunch of vertebrae move and they resonate the lungs and they vibrate. It makes a big crack, crack. The subtle clicking sound are low-intensity vibrations. They're pulled out of the body. It's like fine-tuning, and you'll see an example here shortly. Check out the real-time upper neck vertebrae moving, and this is the source of the vibration. The source of the vibration is from you, from inside you. So the first part's what the correction looks like on the outside. The second part is what it looks like on the inside. So the tension can be transferred back and forth in a human body or between bodies. Tension is a pull. It can be pulled, but it cannot be pushed like a string. It's difficult to push a string. Tension is pulled from you. You always have to ask yourself, how does my voice go through a string on a tin can phone? So we absorb that, it goes back into you and makes the clicking sound resonating my wrist. When it's transferred back into you, it's from you, goes through me, back into you to correct you. So the cycle is complete. When I use your improper internal tension into my core area, absorb it, and then I bring it back out and correct you with it. That's a pull adjustment. Now push adjustments, they're likely to crack a patient. If I jump on top of you, twist you in a pretzel, and push. So this is a pull adjustment. Pull adjustments pull the tension through, and the vibration resonates my wrist area. So if it sounds like my wrist is clicking, and it's not your neck, it's because my wrist is resonating. But it's from you. So there's also a way to move tension in the body where you push the anchors or the bony levers the tendon ligaments attached to. You move the anchor, the ship moves. So you can do that too. It's life-changing for sure. Not everybody gets that kind. When they come in, we assess each case individually. People love us. This is our secret sauce. That a lot of people are afraid of the cracking, don't want their necks twisted. That's their favorite thing about us. We don't twist their neck. You lay on your side, you just either tap it in or kind of screw in the neck vertebrae and the body's vertebrae. And the tension releases and you have a thing called ease, especially with active release technique. So the Golden Gate Bridge is a good example of how tension helps structure and is a part of structure, of course. So that's a relation, big fiber, bunch of steel cables inside of it, and you put the tension up before you drive on it. Don't get this out of order in your care. It'll mess you up. Once the tension is established, then you build the road and you drive on it. It's beautiful. But when things are twisted or crooked, you get knots, you get pain, you get inflammation. Dis-ease. It's the Como Bay Bridge that was not built properly for the wind conditions and the environmental conditions. But here is how it relates to your human body. When you're bent forward, hunched down, you feel dis-ease. Pain, inflammation, degeneration, dysfunction. Things not working like they should. Strange, odd conditions. I see a lot of those. When you look at somebody like this, that is common, but it's not normal. Just because a lot of people have it does not mean you have to have it. When your body stands like this, it's easier to do better work. It's easier to be better in every way. Eventually I want you to feel like this, though. That much energy, boom, at least half of your day. Ease is not enough. I want you to have an amazing life. I want you to be super energized. If you do the power postures, you eat right, you continue through the cycle or two of chiropractic care, upper cervical, ART, a specialty. We'll show you how to use tension for you instead of against you. And then you can pass on the knowledge of this healing art to somebody else who really needs it. Because the world needs a lot of this. And our whole purpose is to regain and maintain health for as many people as possible. So here's a adjustment done by Dr. Sweat. Thank you, sir, very much.
In layman terms, the instrument allows the doctor to adjust the atlas angle with a very high degree of precision while applying minimal physical pressure. This unique feature eliminates most patient discomfort during treatment.
percussion adjusting instrument. Top of the head's to the right, stylus is over the atlas. Here's the adjustment.
Hello, my name is Dr. Collan Koeppen, and I'm going to demonstrate an upper cervical chiropractic adjustment. He barely even felt it.